Association of India, working as the Director, Vascular and Endovascular Surgeon at Fortis Hospital, Mohali. I'm also the Vice President of Union International Philology. So I work as a vascular surgeon, and we are going to discuss today about varicose veins. Varicose veins is a disease which happens in the legs, and it happens because of the malfunctioning of the venous walls, which results in the collection of the blood in the legs, resulting in dilatation of the veins and resulting in formation of varicose veins. It can affect the patients in many ways. It can cause them swelling in the evening. It can affect their legs in terms of pain, and patient can also experience some complications if you don't get them treated in terms of thrombosis, infections, bleeding, and the worst thing is to have a venous ulceration in the legs. This disease is very easy to diagnose because as soon as the patient stands, you can see the dilated veins in the legs, and patient can easily diagnose it with an investigation as a confirmation with a duplex ultrasound of the legs. Once you have a diagnosis, the treatment is very simple. So you have to know that there are no medicines which will cure the varicose veins, neither homeopathic, neither Ayurvedic, neither any other medicines. Even the stockings is a temporary treatment, it does not cure the varicose veins. Because the valves which are malfunctioning, we need to repair them, but that's why we need to do the treatment for them. So the best treatment is a minimally invasive treatment which is done under local anesthesia, and it's very straightforward. It takes around 1 hour in the hospital and you can go home. You don't have to take leave, you can join your work next day, and it's very, very simple. If it's done properly, it has got very, very low risk of any complications, and it's very safe. There are various ways which you can use to close the veins. We can use a laser, we can use radio frequency, we can use microwaves, we can use a glue, we can use a foam sclerotherapy. So what technique to use in individual patients is decided by us depending upon various things, and we decide what is best for the patient. So you should contact your doctor to see what is the best treatment option which should be done in you. So once we have done the treatment, we continue to follow you up for 4 to 6 weeks, and then we follow you up at 6 months and 2 years, and if you are okay at 2 years, we discharge you from the clinic. So most of the patients, once we have treated, we don't have to wear stockings after 4 to 6 weeks. But sometimes you get post-thrombotic syndrome. What that means is you get a DVT, and post-clot in the deep veins, you get a varicose veins. Now that's a totally different ball game, because if you get a varicose veins post-DVT, you need to continue the compression for a very long time. So that's a very different thing from the normal varicose veins. Then a very pertinent question which people ask is, does the varicose vein recover? Yes, because varicose veins is a chronic venous disease. So 3 to 5% of the patients will have a recurrence of the varicose veins, and these recurrence can happen in the patients who are not treated properly, or the valves are missed, or maybe plainly because the disease progression. So because of the disease progression, if you have a recurrence of the varicose veins, you must get them treated as soon as possible, because if you leave those valves more open, these veins will keep on getting dilated, and you will have the same complications as the primary varicose veins. So if you want to have any further information regarding this disease, please free to contact us. We have got websites and Instagrams, and you can have further information from us, because prevention is the key. Thank you.